Good evening, dear viewers, and good evening, Abdullah.
Good evening, Dr. Fatma, and good evening, dear audience. Welcome to a new episode of your weekly program, Medical Talk, the program that brings you trusted medical knowledge to help you and your family live healthier lives.
So today's episode is about mental health, and mental health is just as important as physical health, yet many conditions remain understood or overlooked and mysterious.
Yes, Dr. Fatma, one of these conditions is obsessive-compulsive disorder, or OCD, a disorder that can significantly affect a person's daily life, thoughts, and behaviors.
Definitely, Abdullah, and today we are here to discuss this important topic to understand it fully. And we are pleased to welcome Dr. Najah Alenezi. She's a consultant psychiatrist, and she's going to explain to us and elaborate fully on this important topic, OCD. Yeah.
So, dear viewers, stay with us. I'm Abdullah Al-Ajmi.
And I'm Dr. Fatma Al-Ansari, and you're watching Medical Talk.
Hello, dear viewers, and welcome to another episode of Medical Talk, the program where you get your trusted medical knowledge from. Today we have with us Dr. Najah Alenezi, consultant psychiatrist. Welcome, Dr. Najah, to the program.
Thank you for having me today.
Welcome, Dr. Najah.
Dr. Najah, what we're going to talk about today is OCD. So for our first question, what is the obsessive-compulsive disorder and how does it affect a person's daily life?
Okay, so thank you for having me again. Obsessive-compulsive disorder, from neuro perspective, it is a disorder in the neurobiochemical of the brain, corticostriato-thalamocortical circuit. It's difficult, I know, but to put it in a simple terms, it consists of obsession and compulsion. And what is obsession? Obsession is a recurrent, intrusive, unwanted thoughts, urges, or images. Resulted in obsessions like cleaning, washing, counting, checking, both driven by severe anxiety.
So, Dr. Najah, what are the common types of obsessions and compulsions that you see in OCD?
So, the commonest type of obsession is obsession of contaminations, fear of germs or germs, need for symmetry, intrusive thought taboos, having an intrusive thoughts of sexual, religious content, thoughts of or fear of harming yourself or others. Regarding the compulsion, the commonest is washing or cleaning, checking, fixing things till they feel right.
Several times a day.
Several times a day. Repeating some words compulsively.
Yes.
Dr. Najah, you said it's obsession with symmetry and you can say like avoiding germs and different bacteria maybe. How can we differentiate between OCD and regular behavior? Some people maybe they don't like germs, maybe they like things symmetry. How can we differentiate between OCD and normal behavior?
So normal behaviors or things like habits, it's purposeful. It is not driven by severe anxiety or fear like obsession, never time-consuming, and does not cause distress of patient life. Obsessions on other, whereas obsession is a severe, recurrent, intrusive thought driven by fear or anxiety. Patient try by these thoughts, he tried to avoid these thoughts and do a compulsion to get rid of these severe anxiety associated with these, the mental thoughts.
So, Dr. Najah, at what point do you think a person should seek professional help and see a specialist if they think or a family member notices such abnormal behaviors?
As early as possible. Obsessive-compulsive disorder, a disorder which looks like funny in the very beginning because some would, attribute it to different things. My daughter, she's precise, she loves things to do perfectly, or my son take a great care of his hygiene, so he's washing a lot. However, things does not count like this, obsessive-compulsive disorder when there is a social withdrawal, or when there is a distress, a significant distress, or if these obsessions or compulsions are time-consuming, that the person cannot perform as expected. So you need to seek a professional help.
Especially with our religion, being
Definitely.
Muslims,
Yes.
do you see a lot of religious people
Definitely.
are more?
Yeah. So to put it clear for you, how it starts, having a rituals, like we pray five times a day, or
Yes.
we do al-wudu, we wash hands 3 times a day, we wash face 3 times. So some would say, did I wash it right? Did I forget the counting?
Yes.
So to get rid of these thoughts, when it is recurrent, I'll do it, I'll start over. Then he would start over. Then, no, I'm not sure. Did I count right? Or was the water clean enough? No, they'll start over. So cycle will go on and on. And it would end that this person who usually pray 5 times a day, he cannot pray.
Yes.
Because he cannot even wash his hands or face as needed before prayer.
They would get distracted a lot and probably lose count
Definitely,
even.
yes,
Yes,
yeah.
yes.
It's a really interesting topic, since I think a lot of people who suffer from this disease exist in the society everywhere. But Dr. Najah, thank you so much for answering these questions and its informative answers. We still have more questions for you, but dear viewers, don't go anywhere. We still have more questions for Dr. Najah after this break. Welcome back, dear viewers, to Medical Talk. We're still with Dr. Najah Alenezi, consultant psychiatrist. Dr. Najah, we're still talking about OCD. So can you tell us what are the main risk factors of OCD?
So it is a multifactorial mental disorder, genetics, biochemical, environmental. It has a multiple factors involving brain circuit and the first, degree relatives who had like OCD, they are more susceptible to develop OCD. So it's a mix between these factors.
So it's also genetic, you can say.
It has a genetic pre-component, it has a biochemical reasons, it is environmental, so it is like a multifactorial disorder. The exact cause of OCD is unknown. However, we have these factors to
so it's not 100% genetic, but
no,
some factor
definitely
may
no.
increase the chances of
Definitely, yes.
So Dr. Najah, how can OCD impact a person's relationship with others and their quality of life?
So definitely it has a direct impact on the quality of life. It has a negative impact. It affects patients in his life, academic, social, or familial life. It causes social withdrawal. People would perceive the person with OCD as if he's doing irrational, illogical, with a weak personality, which is even more distressing to patients.
Dr. Najah, if we're talking about OCD, so what are the main treatment options a person can maybe look into if they want to get treated?
So a biochemical treatment is needed, plus a definite psychotherapy type stimulus and response prevention. The psychotherapy include a multiple medications with higher doses of selective serotonin reuptake inhibitors. These medications played a great role in addressing the symptoms of obsessions and compulsions.
To be honest, doctor, I thought the treatment would be talking more, not physical medicine.
It's a must to introduce a chemical medications. It's a must. Why is that? Because it's been linked to a disorder in a neurobiochemical change. OCD is a brain dysfunction. Oh. So you need to address this first. No talk or no psychoeducation would help without giving the biochemical treatment. Especially patients with OCD presented late. because they will take their own time thinking that they can get rid of it, because they see these compulsions that it is under their control. However, it's not under their control. So they keep, like we call OCD a wax and wane course. What wax and wane course? It has flaring up of the symptoms, then symptoms would subside, then flare. So we think, oh, it ended, but still it is there. So when it's flare up, sometimes these flaring up of symptoms would last longer, that the patient cannot even leave home, cannot sleep, cannot study, because these tasks takes hours and hours. So the function would be impaired. And here we don't want to reach this stage that you will have a decline of functionality in all your life aspect.
Dr. Najah, do you give them certain home exercises? Like sometimes we hear it's called like homework that they need to do, assignments,
this is
little exercises that you train them to do at home. Do you practice that?
Yes, I do it a lot.
Yes.
To have a successful treatment of OCD, you need to address both behavior, thought, and the psycho circuit, because sometimes to just put it clear for you, when you have thought of contamination, usually it is not toward a rare germs. It is about like dust. You cannot avoid dust. It's about things that is very common in your environment, which make it even harder for him to resist washing.
Yes.
So giving the task needed to make this task or this homework done easy, you need to prepare your patient to give him the medical treatment. Then he can follow the task.
Wonderful.
So just to put it in other terms, when you have a fracture, you need to treat your fracture before your physiotherapy.
Definitely.
You cannot say physiotherapy is the best for broken bones. No, you have to treat then though.
Definitely.
So it goes
they go
together.
hand in hand together.
Yes.
Definitely. Thank you, Dr. Najah, for the amazing information. Dear viewers, we're going to take a little break and we'll be right back. Dear viewers, and we are back again with Dr. Najah Alenezi, consultant psychiatrist. Hi, Dr. Najah.
Hi.
So, Dr. Najah, what are the misconceptions about OCD that should be corrected to our audience?
Okay, some would see OCD as a rare mental disorder, which is not. Some would see that it has a spiritual background, and again, it's not. Some would see this is a weak personality, and it's not. Also, some would see that this is the person or the patients have a weakness of faith, and it's not. These are the commonest misconceptions.
Dr. Najah, we're talking about the misconception. If someone, let's say, who has in their family someone with OCD, how can they support this person and be with them in the best possible way?
Do not criticize the patients. Do not comment on his actions. Although it looks like a voluntary movement, but this is not a voluntary. These compulsions or rituals driven by severe anxiety and fear. Patients would try to put control over this anxiety, and it ends by having a pseudo control.
Yes.
So, and to read more about this disorder, to understand what is going on, and please, as early as possible, you have to seek a professional help.
So people have to be open-minded and educate themselves on OCD to support the people who are living with it.
Exactly, Abdullah, yes.
Have you seen, Dr. Najah, people struggling or hesitant to seek help? Or maybe their family members have reached out to you and told you about their siblings, spouses, parents that they think they are OCD, but they are refusing and they are in denial to seek help?
A lot.
A lot.
Yeah.
Well, how do you approach these people?
So, from my field as a psychiatrist, we do see these patients, relative, coming saying that it would start like he is precise, he is he wants to do everything perfect, or she wants to do everything in a perfect way. She take a great deal of cleaning and which is a bit looks nice. Still, they never complain about this issue, but they would start saying she refused to go out because she thinks that going out would let her, that socializing, it's unclean. She's embarrassing me during el-Zwara, and she's refusing to shake hands with others.
In family gatherings.
Yeah, in family gatherings. So, well, she's not, socializing with others, or he is not going to college anymore, or he is not attending his job as usual, because, leaving the home, it takes hours for the people or patients with the OCD. So my sole advice is check, seek a professional help. Do not criticize. Read more about, or educate yourself about OCD.
Yeah.
Well, Dr. Najah, thank you so much for this valuable information. It's truly an important topic, especially with people who are actually experiencing this and living with people with OCD. Well, dear viewers, that brings us to the end of this interview with Dr. Najah Alenezi, consultant psychiatrist. Thank you so much.
Thank you, my pleasure. Thank you.
Thank you, Dr. Najah.